Today is National Healthcare Day, and we have to ask the question, will the future of healthcare come down to virtual physicians diagnosing an illness we may have, via an app on our smartphone? And we have with us in studio a face that's definitely no stranger to us all, Dr. Darren Green, who will be able to tell us a bit more what he sees in this mobile health trend, where it's going in 2015. Dr. Darren, nice to have you, man.
Thank you. Very good morning to you.
Are you scared, man?
I'm virtual. I'm not actually here right now.
Oh, you're not here right now. Love it. You're on an app. This is great, but we are talking, it is a serious issue.
Indeed.
Where do you see it going in the coming years? Fitness, health apps, we see it every day.
With the boom, and it's World Health Day today, with the boom of awareness around things like balanced lifestyle and preventative health and where health promotion is going, you can imagine that the popularity of these apps and digital health medicine has become incredibly popular. So you can imagine that people want, they have an expectation to get quick help when they need it at any time of the day or night. With our lifestyles that are hectic, they want access to finding out, is this deadly or not? Do I need to get to a doctor or a hospital quickly or not? And that's what they want. They want a screening tool to help them decide when they need urgent help or not. And often, that's where the apps do come in. Of course, we've got apps ranging from helping to monitor your sleep all the way through to your exercise and fitness levels, your nervous system. Where the dangers come in, obviously, is where the role of a previous clinician or physician is to look, basically feel and then move the patient in getting to a diagnosis. Interesting studies have shown that the effect of someone just seeing the doctor, in other words, just seeing that person on the other side of the desk, that human connection, that listening ear actually had an effect on outcomes of illnesses besides even giving medication or medicines, for example. Obviously, a lot of bad stigma around doctors that just prescribe pills, the antibiotic-resistant eras and that kind of thing are driving a lot of the move towards looking for other alternatives and even the growth of integrative, functional and alternate medicine in the world nowadays. But I think where the future is going to be looking at when to seek medical help will still be important. I feel personally that you won't be able to totally cancel out and rule out seeing the physician because there's certain things that you need examination for. Interesting in terms of the world at the moment is that we even have tools in telemetry, for example, where you can Skype consult someone, where you have tools to listen to their chest, for example, where they just need to place the stethoscope or the listening device at the right place.
But once again, you have an expert doing the actual work, even though you're not physically in the room with that person. And this is the danger. I want to ask, you spoke about some of the dangers. Misdiagnosis of certain things. This is obviously an important point, right?
Yes, it's like cyberchondria, we call it. And, also Dr. Google obviously can cause a lot of anxiety and fear amongst patients. But I welcome, obviously, that interaction with the patient of being able to ask about whether something is dangerous or not. The problem is people then trust it as being, obviously, themselves being at risk of having the worst possible condition when they look at something, for example, like a red rash. They don't have the clinical insight to know the different pockets of diagnosis in terms of interpreting that red rash as to what is suggestive with, for example, associated signs and symptoms in the entire clinical picture to get to the doctor to exclude something like meningitis, for example.
Exactly.
So, that's where the future's going.
Well, you know what? We can't deny the fact that, people are getting smarter, technology is getting smarter.
Indeed.
In the far future, I know we're far from it, but do you see doctors being almost obsolete, not being required anymore?
I see them in a different role. I think I see a partnership with digital medicine, and I see a partnership with these health apps where, for example, we don't congest and crowd our emergency units for problems that are minor problems. I see people becoming well-informed and educated about medical conditions through the apps. In that way, using over-the-counter meds earlier, for earlier diagnosis and intervention to prevent the complications of disease. The problem is just always educating yourself and knowing where your limits are.
That's it, exactly. Very, very interesting topic indeed, Dr. Darren. Thank you so much. Well, Dr. Darren is staying with us for the rest of the morning. He's going to be taking your healthcare-related calls. Remember that magic number, 0839133728, 0839133728. Call us, and Dr. Darren Green will be taking your calls in just a little bit. Right now, though, here's Graham with a great competition for you.